Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this video is part 2 of a little Q&A about treating marcons, or multiple antibiotic resistance coagulase negative staphylococcus. I posted a video about marcons some time ago. Someone posted a very thorough, insightful question about, or a couple of questions about this topic, and I started answering, well, I answered part of it in the last video that I posted, so I'm going to answer the rest of that question. And as I mentioned at the last part of the last video, there's actually questions at the beginning and then a bunch of kind of background information here. So I just took a quick read through it. I've got it up on my screen here. And so in essence, kind of the subtext for these questions, if I'm paraphrasing this well, is that a lot of clinicians will treat for marcons, this basically staphylococcal sinus infection that oftentimes will coexist with there being a mold illness issue or a mold, possibly a mold colonization of the sinuses, or colonization of the sinuses by mold as well. And that the general protocol is, put the patient on a binder, put them on a nasal spray, and then it should all work out just fine. But the question is indicating that a lot of folks can flare up from that, and what can you do to mitigate that? So in the first part of the Q&A, I addressed that to a large extent in terms of things that can be done to help mitigate the reaction to the treatment. But there are a couple of other questions here that were tied into this that I'll answer now. And as per usual, nothing I'm saying should be construed as medical advice. Please consult with your personal health care authority before making any treatment decisions for yourself. So the second part of the question here is, should focus be placed on strengthening a healthy sinus microbiome via probiotics? That's a really good question, and definitely something that people don't talk about often or ever, is the sinus microbiome. When I'm treating patients with known or suspected marcons alongside known or suspected mold overgrowth, and as I mentioned in the last video, there could be other things growing in there. Sometimes when we've done sinus cultures, we find a lot of yeast in there. There's some reports of there being Lyme or co-infection microbes hiding out in sinus biofilms. There can be lots of critters in there. But by and large, I usually don't ask patients to go on a sinus probiotic protocol leading up to that treatment. I have certainly had some patients where no matter what we do, no matter how gentle we go, whether it's super, super low dose essential oil nasal spray, it's always diluted essential oils, never straight essential oils, but even like super, super diluted, like that flares them. Silver hydrosol nasal spray flares them. Nebulized essential oils flare them. There's this compounded nasal spray we use that has grapefruit seed extract and xylitol and iodine in it. That flares them, like they flare from everything. And so I have had a handful of patients where we've just gone right back to basics and said, okay, let's start using a nasal probiotic. So literally nasal probiotic drops. And that has been well tolerated when those other formulas were not. Actually, in the past, prior to fully fleshing out all of the myriad nasal spray treatments that we use now, one of the only tools in my tool bag was actually using probiotic nasal drops, and they actually helped a lot of patients. It was like, oh wow, this is like working so well. But then the honeymoon was over, and it didn't magically rectify every case, but they can be really, really helpful actually. So that is certainly something that we can fall back on if we need to, but it's not something that I do ahead of time. Now, with that being said, I haven't really thought about it like really in a focused way since this question came up, and it's like, oh, it's not a bad idea. But the reason that I probably won't start doing that in a standard, like making that part of my standard protocol, is that usually the nasal spray goes pretty smoothly as long as we, start low, build slow, and all of that, like I mentioned in the last video. But it's a good thought. And if a patient came in and said, hey, like I want to do everything I possibly can to mitigate the chances of a flare-up when I start using a nasal spray, using some nasal probiotics ahead of time is a really reasonable idea and quite a good idea, because even just on their own, they can work quite well, as I mentioned. And then the other question is around, is it a good idea to strengthen the blood-brain barrier? That's a really good question too. Also not something that I typically do to prep a patient for using a nasal protocol. It's a good thought. I'm just quite frankly, not really sure if it would make much of a difference because, to my understanding, mycotoxins are so tiny that they can easily get into our circulatory system. And the blood-brain barrier, ultimately, what makes it so special is that its gap junctions between the red blood cells are like 1,000 times tighter than they are anywhere else in the body. So it's really hard for stuff to get in there, but it's not impossible. And I'm not 100% sure. I'd have to, dig out some course notes and look at molecular weights of mycotoxins and whatnot. But I think that the mycotoxins are small enough that whether you've got a leaky blood-brain barrier or you've got a really robust one, I don't know that it would make a huge difference. I mean, you don't want a leaky blood-brain barrier. Good to resolve that, and hopefully part of a prep protocol getting ready for doing some treatment would involve that anyways. Like I know in my practice, I would generally speaking, with some exceptions, but generally speaking, put patients on like glutathione, for example, or this combination formula we have that has some resveratrol in it, which is helpful for the blood-brain barrier, to my understanding, and certainly working to try to reduce inflammation in the body, and maybe work with some other things too. So it's not a standard part of a prep protocol for me for a marcons treatment, but if a patient was having a lot of neuroinflammatory symptoms as we were working on killing off marcons, then doing some work to help support the blood-brain barrier would likely be a good idea. A lot of those treatments would also be like the blood-brain barrier support therapies would also be helpful to reduce neuroinflammation and whatnot anyway. So we'd kind of be doing that anyways. It would be like a spillover benefit. So yeah, very good questions. I hope that answered the questions. I hope I encapsulated what you were asking there. So if there's follow-up questions to that or questions about this or anything else, just post them in the comment section below, and I will get to them as soon as I can.